Hi everyone. I had the opportunity to research and study more in-depth muscular dystrophy along with Juliana and Myriam. So what muscular dystrophy is it is a genetic disorder that's characterized by the gradual progression of muscle weakness and muscle fiber degeneration. So I think this picture up here really shows it really well, as the bicep on the left is more thick in volume due to the greatness of the muscle fiber the muscle fibers, whereas the one on the right is much thinner in volume. And it's caused by a gene mutation, which I'll talk about later. And there's no neural involvement, meaning the nervous system and the muscular system aren't communicating well, which leads to the degeneration of skeletal muscles. And as it progresses, in some types, it progresses into the cardiac system, which is why people with muscular dystrophy, certain types, have a much lower life expectancy because it affects their heart eventually and causes it to stop. So it's a neuromuscular disorder, meaning it affects the voluntary muscles. And there are 9 types of muscular dystrophy, and the most common is Duchenne dystrophy, which accounts for 50% of cases, which if you know anybody with muscular dystrophy, especially children, it's likely that they have Duchenne. And then Becker muscular dystrophy is the second type, and that accounts for about 30% of cases. So what are some symptoms of muscular dystrophy? Family and developmental history assessment is huge. Because it's a genetic disorder, you have to see if one of your parents is a carrier of that gene mutation. Physical things that you might look for, you'll look for a history of delayed motor milestones. So is your child walking late, or is he crawling late? Or are they able to raise their arms or walk upstairs well? Or do they walk well, or do they waddle? And then with adults, you'll see progressive muscle weakness within the leg space and shoulders. So as I said earlier, it's all with voluntary muscles. So how is the mutation affecting your voluntary muscles? And then because it affects all areas, ongoing emotional support is needed, and you'll have to remind them of that. So like I said, it is a genetic disorder, and it's caused by the absence of dystrophia, which is a protein of muscle cells. And because of that absence of that, it prevents adequate cell functioning, which leads to necrosis or the death of muscle fibers. And I think this picture really shows how it is genetic. You can see that the mother is the carrier of that gene mutation, and she passes it on to 2 of her children, but only the son actually inherits the chromosomal disorder and is affected by it, whereas the daughter is just the carrier, and then the other 2 got healthy genes. So what is the diagnosis of muscular dystrophy? Because the symptoms are small, it's very hard to pinpoint, but once it is pinpointed and diagnosed, you have to react and respond early on, because it continues to progress very quickly. And some of the diagnoses are impaired physical mobility related to muscle destruction, as well as muscular biopsy, which is taking a sample of the muscle to see if the dystrophin is present within that, to see if that protein is there. Another one is DNA testing because of that chromosomal difference, and then a blood enzyme test, which looks for kinase, which reveals the inflammation or the death of those muscle cells, because that is what muscular dystrophy is. So there is no cure to muscular dystrophy, but treatment is done to reduce the problems within the joint and the spine. One common one is exercise therapy, which are like ambulation, joint mobility, and muscle control to try to keep those muscles mobile for as long as possible. Braces and crutches are used to aid in muscle strength and mobility. And then education is a big one, so that you can strive to allow people to remain mobile for as long as possible. And finally, like I said, there's no cure for muscular dystrophy. Most people diagnosed with the disease will eventually lose all mobility within their limbs, and they will end up in a wheelchair, where when in life that occurs varies among patients and diagnoses. And then treatments such as physical therapy and braces can help slow the onset of the disease. So catching it early on is really important. And because this impaired physical mobility is a progressive disease that limits normal lifespan, it's important that we as nurses, as well as Christians, are there for people, our patients, or people that we personally know, to support them emotionally and physically and spiritually, so that they are able to feel supported and loved despite this impairment. Thank you.